Hello and welcome to the July edition of the PigX podcast. As always, I'm your host, Delaney Howell. We have an action-packed episode for you today that we're going to be featuring in two different parts. Today, we'll be introducing to you two new guests to the podcast, both coming from Kansas State University. This will mark the first episode of a two-part mini-series where today we'll be discussing diagnostic insights into investigating bone mineralization in nursery, growing, and finishing pigs. Next month, we'll dive into the research on the calcium and phosphorus requirements for gestating and lactating sows. So we've got a lot planned for you in these next few episodes. To start us out with this mini-series, let's meet our guests, Dr. Jordan Gebhardt and Ph.D. student Larissa Becker.
My name is Jordan Gebhardt. I'm an assistant professor here at Kansas State University. Grew up in a small town in West Michigan on a small family farm and feed mill. Came out to Kansas State for my veterinary training, as well as a PhD with our applied swine nutrition group. I've been very fortunate to be able to be on faculty after completing training and have been here assistant professor in the College of Veterinary Medicine at K-State for coming up on 4 years.
Hi, I'm Larissa Becker. Thank you for the invite for this podcast. I'm finishing up my PhD program here at Kansas State University studying swine nutrition. I grew up on my family's swine farm in Fairmont, Minnesota, and so I was fortunate enough to be exposed to the swine industry from a very young age. And from there, it just grew into this very strong passion for nutrition. And so I look forward to wrapping up my PhD program and entering the swine industry as a production nutritionist.
Fantastic. Thank you both for sharing your backgrounds. And you both have gotten to do some really interesting research at some really interesting times when we saw COVID impact a lot of swine operations, which it sounds like really led to this research that Bo Williams put together looking at bone mineralization. Jordan, do you want to maybe give us that 10,000 foot view history of how that research came to be with Bo?
Absolutely. And that was really in the early stages of my career, just starting out on faculty. And really during that time of COVID, a lot of growing and finishing pigs were having significant issues with lameness. And we as an industry continue to struggle with lameness even today. But really it was during that time of COVID, significant market disruptions. We're doing a lot of unique things within our production system to make the best of that situation. And there were a lot of diagnostic investigations digging into that lameness, trying to understand what was the cause of it. Was it an infectious disease process causing that? Was it our management practices and keeping those pigs at a higher stocking density for longer as we're trying to make space in the system? Or was it something nutritional related? Is it something with our calcium, our phosphorus, vitamin D, something that we can change from the diet? So through the course of some conversations with a number of different veterinarians, nutritionists, and production systems, it became very evident that we needed to connect all the pieces, including working with our diagnostic partners, pathologists at the veterinary diagnostic laboratories, veterinarians in the field, nutritionists, to understand when we have these lameness cases, and we want to go down this route of investigating bone mineralization, what are the best samples to take? What are the best diagnostic tests to perform? And what would we expect from those diagnostic results under a variety of situations? So that's really where Bo's PhD research came to be, where we conducted a few different experiments where we fed diets with different levels of phosphorus, different levels of phytase and vitamin D, to create a range of these measurements of bone mineralization. So we fed diets where we know we would change those responses. Then we used some different diagnostic techniques using different bones, urine, blood samples to evaluate how those measurements would all fit together. And then the third project from Bo's work was what we called a diagnostic survey, where we went out to 64 different production sites, 14 different swine production companies, and evaluated healthy, lame, and sick pigs from those systems, collected a bunch of different measurements, bones, urine, and blood samples, and then evaluated how those measurements all came to be and how they all compared together. So really, that project as a whole, we really wanted to dig in and understand bone mineralization further. What ranges or what differences could we see under different settings? And ultimately, at the end of that project, coming up with, under modern production practices, modern pigs, what would we expect of a relative normal, if you will, for those values working with our diagnostic labs to ultimately aid in veterinarians and nutritionists and producers to make the most educated decisions when it comes to measuring bone mineralization.
Why do you think it was that there wasn't a standardized way to measure bone mineralization before Bo tackled this project?
Yeah, so a little bit of the history about bone mineralization. It's a relatively simple process. There's a few different techniques that can be used. Basically, what we're doing is taking that bone, drying it, and then ashing that bone to give the remaining materials what we call bone ash. Then, from that bone ash, the amount remaining, if we compare that to the bone before we ashed it, we can calculate the bone ash percentage. A very common procedure, relatively straightforward. Now, where it gets a little bit more challenging is the specifics of that process. There are two ways of doing that. In bone, in the center of the bone, the intramedullary cavity, there is fat. There is lipid within inside the bone of all animals. And the amount of fat within that bone can vary quite dramatically depending on which bone it is and depending on the phase of production, a nursery pig versus a growing and finishing pig versus a sow. So the two techniques to determine that bone ash is either to leave that lipid within the bone, what we call a non-defat technique, or we use a process to extract that lipid from that bone, and then we ash that bone. When we remove the fat, what we call the defat bone ash procedure, and then ash that bone, we see an increase in the bone ash percentage of somewhere between 6 and 12% relative to that non-defat bone ash. But they both are measuring essentially the same thing. It's just whether or not that lipid is accounted for within that calculation. Now, where that becomes important is when, as a veterinarian or a nutritionist or a producer, when I send a bone to a lab to perform an analysis, I get a result back. I get a number. What then I need to do with that number is then compare it to something. What do I do? Is that normal? Is that abnormal? Is it high? Is it low? Is it right in the sweet spot, right in the middle? That's where it becomes challenging is many of the values that we report or we compare back to were established 20 to 30 years ago. Some of them may be correct and accurate based on today's production setting, today's genetics, some of which may not be. That was a real question that we wanted to work towards understanding further within Bo's work. What we see today, how does that compare to what we have been using as established reference intervals that may be a few decades old? So that's kind of the background of it. And one of the key takeaways from that is that when we get a diagnostic result, whether it's bone mineralization or any other test, making sure we know what we're comparing that to and making sure that that comparison is truly an apples to apples comparison is really, really important. What bone it is, what technique was used are the two main factors that can influence that decision of what do we compare to.
Tell me a little bit more about the two studies that were done after the Minnesota Pork Board put out a call for this research through a grant.
So the two projects that we conducted were with nursery and finishing pigs. We started with the nursery pigs, started with a roughly 25-pound pigs. We fed different diets with different levels of phosphorus. We knew that once some of those low phosphorus diets would be below their nutritional requirement. And we know that when we feed phosphorus below their nutritional requirement, we limit bone mineralization. So we had that as our lower treatment to create a situation where we had known pigs with known bones that were deficient or had lower mineralization than expected. We then fed phosphorus levels, what we thought the requirement were, as well as fed phosphorus requirements even higher than that, which is very common for what we see in modern swine production, generally being fed a little bit higher than what we would estimate that requirement to be based on the 2012 NRC requirement tables. So we had that, but then also we incorporated some different concepts related to vitamin D as well as phytase inclusion. In the nursery study, we had normal industry levels of vitamin D. We had a treatment with no added vitamin D. And we had a treatment with normal levels of vitamin D3 with the addition of a 25-hydroxy vitamin D3 product added at the manufacturer's recommended levels on top of the vitamin D in the diet already to create a situation where those pigs should have had plenty of vitamin D to maximize bone mineralization. So again, all those treatments were done to create differences in bone mineralization. Therefore, when we collect those samples and analyze those samples using the different techniques, we could see how well those different diagnostic tests could pick up differences in bone mineralization or serum levels of vitamin D or calcium or phosphorus. And then we recreated using a relatively similar treatment design with older pigs, growing and finishing pigs in a large study in southern Minnesota. The same thing, where we fed pigs below their phosphorus requirement, at or above the phosphorus requirement, to understand how those different diets would affect the response to bone mineralization measured using some of the different diagnostic techniques. And those two projects really were the foundation of then that diagnostic survey where we went out into the field, evaluated these different measurements with sick, lame, and healthy pigs to really put the bow on the project, if you will, to wrap everything together.
Yeah, so your extension of Bo's research really was to do that extended diagnostic survey. Why did you feel like that was the next logical step to take, Jordan? And tell us a little bit more about what that survey looked like.
So that really was based on discussions with the producers, nutritionists, veterinarians. When pigs are sampled and sent to a diagnostic laboratory, there's generally something wrong. They either have been off feed, they're sick. Sometimes we go into a population and sample an apparently healthy animal, send that to the lab for various testing. But most commonly, when samples and when tissues are submitted to a diagnostic lab, that animal inherently was unhealthy. That those tissues wouldn't have been sent to the lab without if that was not the case in most situations. So based on that, there's a lot of questions of these samples we're seeing in the lab have a low level of bone mineralization compared to what we would expect based on the previously established reference intervals. Why is that? Is that a nutrition problem? Is that the pig has been off feed for some period of time because a health issue or some perhaps unrelated issue compared to a fundamental issue leading to problems with bone mineralization? A lot of questions related to that. What that led us to do is say, okay, if we go into a production site, it's the same barn, the same airflow, the same curtain or tunnel ventilated barn, same management, same exact diets to all those pigs in that barn. How do these measurements compare if we sample a healthy pig from that population, a pig that's lame, and a pig that's sick or unhealthy, unthrifty? If we take all of those pigs have been fed the same diets, the same management practices, the same conditions. How do those animals compare to each other? And that was really the goal of that diagnostic survey and was pretty insightful. And we learned that based on health status, we do know that we can change some different levels in the blood. You can see some differences in bone mineralization and some other really important markers as well. So that was really the culmination of what happens if we take from the same setting, the same population of animals, and we evaluate these different measurements within that cohort based on health status.
What did the diagnostic survey sample size and setup look like from your perspective?
So in total, we had 64 different production sites. From each of those production sites, we sampled 3 pigs. So 64 by 3, we're just about 192 pigs total that were sampled. And we wanted to make sure that that was representative of the swine industry. We focused those efforts here in the Midwest. For the project, we were very lucky to have funding and support provided by both the Minnesota Pork Board as well as the Iowa Pork Producers Association. So we really focused our sampling efforts on those 2 states, which are very representative of swine production within the Midwest. So in total, 14 different swine producers with those 64 sites. We thought that was a very robust sample size to get a good degree of confidence in what these measurements would be across a wide range of sites within the swine system here in the United States.
So, Jordan, from those surveys and Bo's research, what were some of the key takeaways that you had when you walked away from that study?
One of the most important ones that we found is that when communicating with veterinarians, nutritionists, and diagnosticians, making sure everybody's communicating the same language is really, really important. And one of the best examples of that is when we perform a diagnostic test, in this case, evaluating bone mineralization by using bone ash, we need to know what technique was used to determine that bone ash. Was that the defatted technique or the non-defatted technique? And most of the diagnostic labs today, they're using the non-defat technique because that's a lot more rapid of a process. If we go through the defatting process and remove that from that bone, it takes an extra several days up to a week to allow that lipid to be removed from the bone, and then that bone will be ashed. In the case of making decisions in a diagnostic setting, time is very, very critical. So most of the time, a non-defatted technique is used because it's quicker, which is perfectly acceptable. But we need to then know what are we comparing those numbers back to. And historically, one of the very common references for bone mineralization was established using a defatted technique, or removing the fat from that bone prior to ashing, whereas that's a different technique than we're using today. So making sure we're comparing apples to apples with the technique that we're using to generate the result that we get with whatever is being used for that reference interval. That was one of the really, really important takeaways from the project that I can't emphasize enough. We also learned that we certainly can change bone mineralization based on our nutritional interventions. And this brings us to some of the work we'll talk through with Larissa, where she's done as part of her PhD program as well, where we feed different phosphorus levels, different vitamin D programs. We know we can change bone mineralization. So those are some pretty important measurements for us to further understand as well. How do these nutritional changes affect ultimately what we measure coming out of the laboratory?
Jordan, whether it be related to your research or Bo's research, is there any further information that you think would be important for our listeners to know today?
I think one of the really, really important pieces, and it's been mentioned several times, but I can't overemphasize it, is making sure that you know what you're testing. When you get a number, make sure there's clarity related to what the technique that was being used to generate that number and what to compare to. We've had some terrific discussions with veterinarians, nutritionists, and diagnosticians. I think everybody really understands the concept that we need to increase our transparency in how we communicate some of this to avoid confusion. But that would be my recommendation to producers, nutritionists, veterinarians. When you get a result back, make sure you know how it was generated and ultimately what the best references are to compare that number to.
Now, Larissa, transitioning into your research, how did Bo's research way back when lead you down the path to conduct the literature review that you did?
So Bo's research showed us that we don't really understand a lot about minerals in swine nutrition. And so then I took it down the sow route and did a literature review to summarize all of the requirements for calcium and phosphorus in gestation and lactation.
Well, folks, if you're interested in listening to more about how Larissa conducted that literature review, learning about her research, and so much more, be sure to hit subscribe and tune back in next month for the final episode of our two-part mini-series. Thank you to both Jordan and Larissa for taking the time to share their extensive knowledge and research with all of you. And thank you all for tuning in to, again, another episode. Until next time, I'm your host, Delaney Howell, and this has been the PigX Podcast.
PigX is a national podcast hosted by the Pig Livability Project partners at Iowa State University, Kansas State University, and Purdue, and supported by the Iowa Pork Industry Center. For more information on the project, head to www.piglivability.org, or to inquire directly with questions regarding the project, email ipic@iastate.edu. PigX, ideas in the swine industry worth sharing.